We just had a long conversation with Jamie Dimon and touched on healthcare quite a bit. Obviously, they're working with Amazon and Berkshire to try and find ways to bring down healthcare costs for their employees. When you look around, if you had some advice to give for people who are trying to fix the industry, what would you tell them? What works for you and what could be used on a broader scale?
I mean, I think a big part of it is the evolution of how do we define and think about health and healthcare. In Kaiser Permanente, we're working on the 3 building blocks now that we're starting to really focus on. Medical excellence is the first one, mental health and well-being, the second one, and social care. Jamie mentioned, for example, 18% of GDP is spent for health care. Well, mixed in there is social care and all the other things that we're talking about. So we need to figure out how to create an ecosystem for health in our country that really starts to bring to bear all of the social determinants of health, how we go upstream in more prevention, how we engage the American people much more in things that they can do for good health, and then how do we continue to drive waste out of the system and take advantage of the technology that's allowing us to practice better in our organizations, and our physicians inside of Kaiser Permanente is doing tremendous work in driving the agenda of medical excellence, for example, and really leveraging technology that enables more efficient care.
What happens when you employ some of those technologies, when you look at a more holistic approach to things? How much do you actually bring down overall costs for healthcare?
Well, we look at it in 2 ways. One is how do we reduce the absolute cost of healthcare over time? And that's a journey that we're all on, and we're not there yet by any stretch of the imagination, but we are definitely seeing signs of progress. The second one is how we manage the trends. And the trends is a big one because, as you know, in the United States, they are trending anywhere from 4 to 6%. We have goals to try to keep, inflation costs plus, right? And we try to keep ours in the 2 to 3% range with initiatives and other things that we're working on, while also improving access and quality and the whole experience that people have with our system, within our system.
Go ahead.
Go ahead.
No, go ahead.
Well, one of the things that Jamie also mentioned, though, is we have worse outcomes in a lot of ways. If you look at things like obesity or opioids, how do you get your arms around some of those issues? How much of that is what you can do for people, and how much is what they have to help you along the way with?
Well, there you go again to part of the problem, right? The obesity, when it is in the healthcare system, it's a fix-me approach.
Right.
The real question is, how do we work with the American people, in this example, around the behaviors that leads to eating the wrong foods, in some cases, lack of exercise, some of the challenges that is related to healthcare, but quite frankly, is in everyday living. And so how do we think that through and create new incentives and programs that gets to the behavior aspect, in which when we get it, it's after the fact, right? And so that's part of how we have to rethink how we provide healthcare in our country.
I wanted to ask what you thought at the very beginning of this year. There was a number of big healthcare deals, consolidation taking place, and there sort of seems to be 2 sides to this story, which is one, we need to bring down costs, and one of the ways to bring down costs is to merge, and that somehow those costs are going to flow to the consumer. And then the flip side is that they're going to merge, and the costs will never actually get transferred to the customer to just make the company more profitable. And so which mergers are you supposed to look at positively, and which mergers do you sit around and go, actually, there's going to be a problem?
Well, you know, the way a couple of thoughts, obviously, because Kaiser Permanente is a big healthcare system, right? So we're approaching $80 billion in revenue, and we take care of 12.3 million people that I round up to 13. So we're on our way to 13. There are benefits with a large system such as ours where you can scale for more efficiency. So there's no question about it. You can come into our system and you will see a level of efficiencies that shows up in less variation, protocols that others have agreed to follow because it's been proven to be effective, an ecosystem of how you take innovation in one part of the organization and then spread it to others. That builds on.
That's the argument for the consolidation piece.
Right. Now, these mega mergers should create efficiencies. The distribution or how those efficiencies are then distributed out becomes part of the debate. In Kaiser Permanente, the efficiency goes back to our customers in the forms of lower rates, and overall, we hope that the unit cost will change. When I say the unit cost, from $1 to 90-something cents, for example, right? What we're dealing with now is instead of the cost going up from $1 to $1.05, we're trying to keep it to $1.02. And so our efficiencies are returned in the form of lower rates. How other large systems decide to distribute those efficiencies obviously is driven by many factors, such as how they're constructed. I'm a not-for-profit. We have a not-for-profit organization. Many of them are for-profit corporations.